Thank you very much for joining us today. I will begin, as usual, with today's statistics. The total number of positive cases reported yesterday was 1,072. That represents 5.5% of the total number of tests and means that the total number of confirmed cases is now 70,732. 460 of the new cases were in Greater Glasgow and Clyde, 210 in Lanarkshire, 112 in Lothian and 75 in Ayrshire and Arran. The remaining cases were spread across 7 other health board areas. I can also confirm that 1,237 people are currently in hospital. That is actually a decrease of 15 from yesterday, and 98 people are in intensive care. That is 3 more than yesterday. And finally, I deeply regret to say that 31 further deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. And that means that the total number of deaths under this daily measurement is now 2,997. Of course, we mustn't ever see these deaths simply as statistics. Every single one represents an individual human being whose loss is a source of grief, and therefore let me again send my condolences to everyone who is bereaved. I'm joined today by the Chief Nursing Officer, and she and I will be answering questions from journalists shortly. Before that, though, let me just update you on a few points. It's perhaps worth highlighting that I've just come from a virtual summit of the British Irish Council. That council enables leaders of the Irish Government, the UK Government, the devolved administrations, Wales, Scotland and Northern Ireland, and the Crown dependencies to discuss key issues together. It is a very valuable forum. As you might expect, the main issue we discussed today was the economic impact of COVID and indeed our experiences with COVID more generally. It was a very constructive discussion, and we all agreed to continue to work constructively and collectively as we continue to steer our way through this pandemic. Let me also reflect that, given that it's an issue I have touched on a couple of times already this week, that yesterday the Chancellor announced that the current furlough scheme will continue until March next year. As you know, the Scottish Government has been calling for that extension for some time, so we very much welcome that commitment. It ensures that support will be there for businesses in Scotland, both under the current restrictions and also if stronger action becomes necessary in order to suppress the virus, and of course gives some much needed assurance for workers who are affected by the pandemic and the restrictions used to control it. Obviously, we'll be considering the levels of restrictions in place in different parts of the country over the weekend and into the early part of next week. The first review point of our new level system is due on Tuesday. I will set out on Tuesday in the Scottish Parliament what we are proposing at that time and also the reasons behind our decisions. But over today and the weekend, we will continue to very closely monitor the data so that those decisions, which will be difficult and finely balanced decisions, are based on the most up-to-date picture possible. Now, there are 3 other issues I want to briefly cover today. The first, at least in part, concerns an announcement that was made last night. The Scottish Government updated last night the list of countries that are subject to quarantine restrictions, and we have now added Germany and Sweden to that list. That means that from 4 a.m. tomorrow, anyone travelling to Scotland from either of those countries will be required to self-isolate for 14 days upon their return. However, I can also confirm that as of this morning, and on the advice of the Chief Medical Officer, we have also now removed Denmark from the quarantine exemption list. That means as of 12:30 today, in other words, just a few minutes from now, anyone travelling to Scotland from Denmark will require to quarantine for 14 days. As you may have seen on the media, in the media this morning, health authorities in Denmark have reported cases in humans of a variant strain of the virus associated with outbreaks in mink farms. We've taken this decision on a precautionary basis, but it is important that we do so. The UK Government announced a similar move last night. Danish authorities, we know, are working very hard to contain this situation, but of course we will continue to consider whether there is a need for any further protections. The UK CMOs will consider updated information later today to assess whether any additional action beyond quarantine may be required, and I will ensure that we keep everybody updated in the normal ways. Again, these changes to countries on the quarantine list really reflect how quickly levels of the virus in any country or area, whether that's here at home or overseas, can change. I'm afraid, however difficult that is, and it is difficult for everybody, it is inherent and it is in the nature of an accelerating global pandemic, and it underlines why we are continuing to very strongly advise against any non-essential travel overseas right now, and I want to underline that advice to all of you today. The second issue I want to cover is also related to the issue of travel. Now, before I cover this point, let me just repeat that the Scottish Government's very clear advice right now is that people should not travel to other parts of the UK unless that is for essential purposes. However, we recognise that some people will have an essential reason to do so. That might be related to work or education, or it may involve caring responsibilities. And so it is really important that our test and protect system is able to take account of that. You might remember that last week I announced improvements to the Protect Scotland app, which meant that it now works in both Northern Ireland and Jersey, and their apps work interoperably in Scotland. That was made possible through NHS Scotland's work to develop a server that allows different apps to work together. Today, I can confirm that the English and Welsh app has now also been updated and joined the NHS Scotland server. So that means if you have to travel to any other part of the UK, Jersey or Gibraltar, you can keep using the Protect Scotland app. You don't have to deactivate it and download the app for the particular part of the UK that you are in. And then you will be notified if someone you're in close contact with gets COVID and enters that into their app, even if that is the app of one of the other countries. Discussions are also underway about ensuring that the Protect Scotland app can operate in other countries across Europe, and we'll continue to look at any other changes which might enhance its capabilities. Today, almost 1.6 million people in Scotland have downloaded the app. It's already notified more than 13,000 contacts to tell them to self-isolate. And in some cases, these people would not otherwise have been notified. And in most cases, the notification would have been quicker because it was done automatically through the app and not through manual contact tracing. So if you haven't downloaded the app yet, then please, if you're able to do so, please do that. And secondly, once you have downloaded the app, if you test positive for COVID, please make sure that when a contact tracer gives you the code, then you enter that code into the app. I know that sounds like an obvious thing to say, but we know not everybody does that. And obviously, unless you do that, the app does not work in the way that it is intended. The app is an additional tool that all of us can use to help keep ourselves safe and people around us safe. Now, my third update for today is about greater mental health and wellbeing support for students. This pandemic has placed an additional and quite severe strain in many cases on everybody's mental health and well-being. But we know that students have faced some particular pressures since the start of the new academic term. Many of them will be away from home for the first time, which is always a difficult adjustment for young people to make. But in addition to that, they're having to adapt to new forms of learning and socialising. And of course, many students have also had to deal with the challenges of self-isolation. So the Scottish Government is providing an additional £1.3 million to improve mental health and wellbeing support specifically for students. The money will allow colleges and universities to enhance the support they already provide. For example, it could be used to expand counselling services, deliver more support online, or improve their ability to check on the welfare of students. Each institution, college or university, will be able to spend the money in a way that they think best meets the needs of their own students, but it should help to ensure that all students get the right support whenever they need it. Now, finally today, given the date and the importance of this weekend, I want to say just a few brief words about Remembrance Sunday and Remembrance Day itself. These are always hugely important occasions for our country. So all of us really regret the fact that because of the COVID pandemic, commemorations this year have to be very different to normal. At the moment, in areas of Scotland under levels 2, 3 or 4, outdoor events and gatherings are not permitted. That obviously means that many local and national events will not be able to take place this year, or will have to be significantly scaled back in terms of numbers of people. Obviously, this is necessary in order to curtail the virus, but it does not and it should not mean that Remembrance Sunday and Remembrance Day go unmarked. On Sunday, on behalf of the nation, I will lay a wreath at the Scottish National War Memorial at Edinburgh Castle. And across the country, services at places of worship will still take place, although there are restrictions on the numbers of attendees. And of course, I would encourage everybody from the safety of your own doorsteps to observe the 2-minute silence at 11 o'clock, both on Sunday and on Remembrance Day, to come to your doorstep and collectively as a country to show our respect and our appreciation. That will be an important way of honouring all those who died in the 2 world wars and subsequent conflicts, and it allows all of us to show our respect for the continuing service and sacrifice of our armed forces, which is important every year. But this year, I think all of us are remembering even more the debt of gratitude we owe to each other and how dependent we are on each other, and that solidarity that is so important in our country. These are the main points I want to cover today. Before we start taking questions, though, I'll just close with my usual reminder of the current rules and guidelines and remind you that we are seeing signs for cautious optimism in our data in Scotland, but we cannot be complacent. If we are to continue that progress, and we must accelerate that progress, then it takes all of us doing all of the right things. The good news is we know when we do those things, difficult though they are, they do make a difference. But they should also remind us that none of us are powerless in the face of this virus. So if you're living in one of the areas at level 3, which is of course most of the Central Belt and also Dundee, please don't travel outside your own local authority area unless it is essential. You can find out what we mean by essential on the Scottish Government website, but it includes work that you can't do at home or caring responsibilities. And people in other parts of Scotland, please do not travel into a level 3 local authority except for the same essential purposes. And as I indicated earlier on, we are asking everybody right now not to travel outside of Scotland to other parts of the UK or overseas, again, unless you have an essential reason for doing so. Travel restrictions are essential. As I indicated earlier on, it was one of the things in the context of COVID that the British Irish Council discussed earlier on, how as we all seek to suppress the virus within our own borders, we work together to ensure that it doesn't spread from high to low prevalence areas. That's important between countries, but it is also important within countries, particularly when, as is the case in Scotland right now, we are trying to apply restrictions in a targeted and proportionate way, which means there are variations in different parts of the country. So please remember the importance of travel restrictions and of abiding by those. In addition to those, of course, no matter where you live in Scotland right now, you should not be visiting somebody else's home, again for very specific purposes like childcare or caring for a vulnerable person. We know transmission within homes is one of the biggest risks and has also in recent weeks, I think, been one of the biggest reasons, because we've not been doing that, that we've seen the virus start to flatten off and hopefully now go into decline. When you are meeting with other households, outdoors or in indoor public places, remember the limit is 6 people and those 6 people should not come from any more than 2 households. Continue to work from home if you can. As I said a moment ago, download the Protect Scotland app and remember the 5 key rules that will help keep all of us as safe as possible. Wear face coverings, avoid places where there are crowds of people, clean your hands regularly and don't forget to clean hard surfaces, keep 2 metres distance from people in other households and self-isolate and get tested if you experience any of the symptoms of COVID. all of us doing all of these things is making a difference. Please believe me when I say that, but we have no room for complacency. As I've said repeatedly during this week, it is not enough as we head into winter to stabilise the infection rate at the level it is at right now. That would not be a stable position to go deeper into the winter with. We must drive the infection down to help protect health and lives, but also to try, particularly over the Christmas period, to open up a greater degree of normality than we are living with right now. So thank you for all the sacrifices you are making, and please, for now, continue to make them for the good of the country as a whole. I'll now go straight to questions, and Fiona and I will answer them between us. First question today comes from Ross Govans at STV.
Afternoon, First Minister. The RMT union says that the Chancellor's extension of furlough has come too little too late for thousands of workers who are already out of a job, especially those in oil and gas, where more than 8,000 have already gone. What more can be done to help those who are facing the winter out of work?
The Scottish Government will do everything within our power and within the finite resources we have to support people through the winter who are out of work, whose businesses are struggling, or who may not be able to work as normal because of the restrictions. As I said today, I warmly welcome the Chancellor's announcement on extension of furlough yesterday, but I deeply regret that it took so long to get to that point. The Scottish Government and others have been calling for furlough to be extended significantly and at an 80% level for literally months now. And the failure to do that before yesterday, unfortunately, has meant that many people will have lost their jobs who might not have lost their jobs had furlough, the commitment to furlough been there earlier, and many businesses will perhaps have not been able to continue. So I think that is a matter of regret. We are where we are, but because of that, I do think that the UK Government, in partnership with the Scottish Government and other devolved administrations, have a real responsibility to help anybody, individual or business, who finds themselves in that position because of that lack of clarity around furlough that has existed now for too long. David Henderson from the BBC.
Thank you, First Minister. With the UK Chancellor now promising that furlough funding through till the end of March, what impact will that have on the timing of any further restrictions here? Is your timetable for change now less urgent? Can we expect new measures to take effect in Scotland later now, perhaps in a matter of weeks rather than a matter of days?
So what it means is that the urgency or otherwise of any decisions we take will be driven, as they always should be, purely by the public health considerations informed by the data of what's happening with the virus. And what it means is that those decisions will not in any way, which I never wanted to happen, have to be distorted to try to fit into a window of opportunity of greater financial support. That would have been a really difficult position for the Scottish Government or any other part of the UK to be in. So whether, as I said earlier on, I came to a view earlier in the week that even when we didn't have clarity, we must try to stick to our own considered rational timetable. That has served us reasonably well so far, and we have to continue to do that. Our next review will be on Tuesday. I'm not going to preempt what the decisions on Tuesday might be, because we have a fairly complex and careful process to go through over the weekend, when I'll be no doubt immersed in discussions with officials in the Scottish Government and clinical advisors like Fiona and the Chief Medical Officer and the National Clinical Director, and I'll set those decisions out to Parliament on Tuesday. But those decisions will be driven by the data and the public health considerations. I've said all along this week that, and said this to try to develop the understanding around what it is we are trying to achieve and why we have to try to achieve that. We are seeing, and you can see this in the figures that I'm reporting every day right now, we are seeing an improvement currently, as of this moment, in the position in Scotland. The rise in cases has levelled off, and we hope is now starting to dip. We're seeing, thankfully, a flattening and slight reduction in admissions to hospital and intensive care. We are still, unfortunately, seeing a large number of deaths every day, but we know that the numbers of deaths are reflective of a position 3 weeks ago, so we would not necessarily expect them to decline quite yet. And yesterday, I indicated to Parliament that we think the R number in Scotland right now is hovering around 1. It might be slightly below 1, it might be slightly above 1. So all of that is positive news, and it should give us cautious hope, and it should also give people across the country in really difficult circumstances the belief that what we do is not in vain, the sacrifices you're making are not in vain, they are making a difference. But the key point I've been trying to explain this week is, given the nature of an infectious virus, we cannot continue with a situation where the infection level remains as high as it is right now, even if it is quite stable, because what that means is that even a slight increase in the R number could very quickly tip the situation out of control and overwhelm the NHS, and that's a particular danger in the winter period, and we've seen that happen in some countries across Europe. So we must continue to drive infection levels down so that we can go into winter with a much lower baseline of infection and hopefully allow a greater degree of normality over the Christmas period, although we will have to be very careful over the Christmas period so that we don't create problems for ourselves in the early part of next year. So the decisions we will take, driven by public health, have to consider whether the current allocation of levels is sufficient not just to stabilise the situation in each area, but actually to see continued progress in each area. And that's what makes these decisions very difficult, very complex, and that makes them require to be very finely balanced. And I'll set out those conclusions, as I say, in Parliament on Tuesday. I don't know if you want to add anything, Fiona, just on the current situation.
I think, as the First Minister says, there are signs that the transmission and the infections are levelling off and in some areas reducing. So what we look for when giving advice is that number of people who are testing positive, that percentage, and the magic number that the World Health Organization has talked about is less than 5% of the population testing positive. We look at the numbers per 100,000 within each area, and we also look at the pressures within our NHS in terms of looking at intensive care, looking at the hospital admissions, and as the First Minister has said, these are out of time sequence, but we now know that, and we've got months of information and data that we can look at and help model so that we can look at predicting with these measures where will we be. So I think the importance is that we keep doing what we're doing. Research recently has shown that it can take up to 28 days for the measures in place to maximise their impact, and that's why it's important that we do keep following the restrictions within our areas and making sure that we continue with this effort to reduce these factors. But these are the factors that we look at, we examine, and in many areas they are looking encouraging.
Thanks. Emily Reader from ITV Border.
Good afternoon, First Minister. Is it likely that Dumfries and Galloway could have their COVID alert level upgraded if we do see a rise in the number of people travelling across the border from Cumbria to do non-essential journeys?
I'm not going to preempt decisions that we might make next Tuesday or the Tuesday after that. I don't think that is helpful to particular local authorities. And of course, discussions with local authorities are part of the decision-making process. But you do raise an important issue, Emily, which I will underline, that when we have a situation where we're not applying one-size-fits-all restrictions across the whole country, which I can't rule out in future, obviously, but we want to try and not have a situation where Dumfries and Galloway or the Highlands are living under restrictions that are actually necessary, not for their levels of infection, but levels of infection in Glasgow or Lanarkshire or Lothian. But if we are to maintain that more targeted, proportionate approach, then I hope it is reasonably self-explanatory that we must then not have people travelling from one part of the country to another, because the danger then is that the virus is spread from high prevalence areas to low prevalence areas, and those low prevalence areas, as you rightly say, will quickly become higher prevalence areas, and the risk then is that they have to have a higher level of restriction. And obviously with Dumfries and Galloway and the borders, they are in the difficult position of, while they have relatively low levels of infection themselves, and I stress the word relative, they are, if you like, sandwiched between parts of Scotland to the north of them that have higher levels of prevalence, and the north of England to the south of them that also have higher levels of prevalence. So it's in the interests of these parts of Scotland, as it is in the interests of the Highlands right now, that those of us living in higher prevalence areas don't put these areas at more risk by travelling there. And your question, Emily, I think really does crystallise and illustrate the vital importance of travel restrictions when we're trying to manage a pandemic in this way. Jack Foster from Global.
Good afternoon, First Minister. Last night we saw a major pressure on emergency services, as we always do at this time of year, due to fireworks. But obviously the impact of COVID and the fact that there aren't any organised displays seems to have had more of an impact than normal. It seems to have particularly affected lower income areas, and last night people in parts of Edinburgh were describing streets as being like a war zone and even fearing for their lives. We heard of cars being set alight and a house which was set on fire due to fireworks in Motherwell. Obviously, this has been exacerbated by current restrictions, the fact that there are no organised displays. But how do you respond to what we've seen last night? And does it make any sense to have fireworks so readily available in Scotland, especially whilst such strict restrictions are in place elsewhere and in other parts of our lives at the moment?
On the last part of your question, the Community Safety Minister, Ash Denham, made a statement in Parliament earlier this week, or actually, forgive me, I think last week, setting out plans. We've had a fireworks task force looking at what we can do to further restrict the sale and the availability of fireworks. It's something I think is merited. I have, as a constituency MSP in the last couple of years, seen the effects of irresponsible use of fireworks on whole communities, and it is unacceptable. So Ash set out the steps we will look to take over the coming year to further restrict the sale of fireworks outside organised displays. The restriction we have is not all of the levers to do this lie within the power of the Scottish Government. Many or some of these levers are reserved and lie with the UK Government, so we also want to work with them to make sure we've got a joined up approach. But I do accept the premise of the question. Can I take the opportunity? The Chief Fire Officer obviously joined me at a briefing earlier in the week to set out the advice for Bonfire Night and appealed to the public to make sure they were behaving safely and not putting our firefighters at undue risk. I should say, firstly, that the vast majority of the population will have adhered to that and abided by that, and I would thank them for that. But last night was an extremely difficult night for our fire service and emergency services. I just want to maybe just give some statistics to put that into context. The fire service received from members of the public between 3:30 yesterday afternoon and 11:30 last night, 1,100 calls. Now, that is roughly, and we can get you precise figures on this, probably about 3 or 4 times what they would in a normal 24-hour period. So that gives you the scale of the pressure. Over that period, they attended approximately 511 bonfires, and most alarmingly, and in my view most unacceptably of all, there were 12 instances of attacks on fire crews with missiles thrown at appliances. Now, I firstly want to thank our firefighters and our emergency services for their incredible response last night, as they do all of the time. But I know how difficult things are for people across the country right now, and I know people feel frustrated, people feel under pressure, people are desperate to let off a bit of steam and get back to a bit of normality. I understand that. But the more we have people breaching rules and advice right now, the longer it will take to do that, because there are risks being created of spreading the virus. So I would appeal to people, difficult though it is, the more we all do the right things right now, the sooner we can hopefully get back to, if not complete normality, then more than we have right now. The final thing I want to say, and this is, I don't like this being associated with whether it's low income or areas of deprivation. I don't care. The vast majority of people living in low income areas behave impeccably. So let's be careful that we don't indulge in stereotypes. Anybody who was involved in any of these incidents of attacks on firefighters last night or throwing things at fire appliances should be deeply ashamed of themselves. There is no excuse anytime, anywhere, in any circumstances to attack emergency workers, and attacking firefighters on bonfire night is particularly reprehensible. So I condemn that behaviour. Those who did that, they will, in the normal way, where appropriate, face the full force of the law, and so they should. And in condemning that behaviour, I also will just end this contribution by again conveying my heartfelt thanks and appreciation, I'm sure on behalf of the vast majority of the country, to our firefighters for the work they do each and every day, often putting their own lives at risk to keep us safe. Can I go now to Ali McGilvray from Bauer?
Thanks, First Minister. Just picking up on that point there, Radio Clyde's been reporting today about the crowds who attended an illegal display in Greenock last night. Do you agree with your MSP Stuart McMillan, who told us people will get COVID because of this? And in hindsight, was allowing the sale of fireworks this year when there were no public displays a bad idea?
It comes back to the point I made earlier on. The Scottish Government doesn't have complete power to ban the sale of fireworks. We are working to try to better regulate the sale of fireworks, but we cannot do things that don't firmly lie within our powers. But we have been working hard to try to get to a position where we have a much greater regulatory framework around fireworks. Look, Ali, I'm not going to comment specifically on individual incidents, not least because I don't know whether any of these incidents may be subject to ongoing police action or investigation, so it would not be appropriate for me to comment on individual specifics. But in terms of Stuart McMillan's comments about incident in his constituency, if I can generalise that and move away from the specific, and I say that I take no pleasure in saying this because I know the implications of this for people wanting to gather with friends and family in all sorts of different ways and forms right now and not being able to do so. But every day when I sort of read out here the facts advice, one aspect of that advice is avoid crowded places. And the reason for that is that we know when crowds of people come together, the risk of transmitting the virus increases, because this is a virus that jumps from person to person. So if you come together with lots of people, you're not just risking passing it from one to another, you're risking having it pass round lots of different people. So if you are being anywhere right now where there are crowds of people, particularly indoors, but outdoors as well, then yes, it is the case that you are risking getting COVID, and if you maybe have it and not know it, you are risking passing it on to others. And any time a group of people come together in that way right now, I'm afraid it is right to say that there is a possibility, if not a probability, that COVID cases will result from that. And that's, it's a pretty blunt and hard thing to say, but that's the reality of the situation we're in right now. And it's really difficult. This is a time of year, Halloween last week, bonfire night. We're going into a period of the year where people would normally be thinking about Christmas parties and get-togethers with friends. The last 7 months have been tough. It's going to be even tougher, I know, over the next few weeks. But if we let our guard down now, we are going to prolong this and make it more difficult and see many more people affected by COVID than would otherwise be the case. So I appeal to people to continue to display the common sense and sense of responsibility that the majority have done for a bit longer while we steer ourselves through this second wave of a really horrible and dangerous virus. Fiona, do you want to add anything on gathering together and why it's a thoroughly bad idea?
I think if it weren't a thoroughly bad idea, then we wouldn't be advising people not to do it. And one of the other key aspects that when we create our advice to give to the First Minister and others is, do we know where outbreaks have come from? And that, what we call sustained community transmission, is one of the key things that keeps people in a higher level than they would normally be. Where we know where the outbreak takes place, so we've had some very specific outbreaks where we've been able to go in, the incident management teams have managed them well, and it has been contained. But gatherings like this mean that there is much more likely to be that sustained community transmission, where we're not quite sure where the infection has come from. And then very quickly and insidiously, because we can't contact trace as effectively as we could if we'd known precisely where the transmission occurred, then it gets a chance to spread, and it gets a chance to spread to the older generations. And that, as we know, is where a lot of the harm and a lot of the damage comes from. So it's incredibly important that everyone follows the rules, recognising the consequences of how easily this virus can be transmitted. And it's not only then yourself that you're putting at risk, it's other people that you're coming into contact, and that can often have quite devastating effects.
Thanks, Fiona. Tom Eden from PA.
Thank you, First Minister. Good afternoon to you both. First Minister, I want to ask you about travel restrictions between the new tiers. Obviously, you've said that police can't check every journey. It's very early days, but what is your understanding of public's compliance with these new restrictions? And are you aware of any arrests or action taken against rule breakers? And directly to the Chief Nursing Officer, if I may, based on your experience and understanding of the impact of coronavirus in care homes, do you believe there's any benefit or lessons that could be learned from an immediate public inquiry?
I'll hand over to the Chief Nursing Officer in a second. I don't have any data in front of me that would allow me to answer that question in detail about what we understand compliance to be, and obviously it would be for the police where they have enforcement powers, which is not the case at the moment in terms of travel restrictions. It would be for them to set out, as they do regularly, numbers in terms of arrests or prosecutions or fixed penalty notices being applied. Obviously the travel restrictions are necessary in this current stage of the pandemic, and particularly given how we are seeking to manage it with a level system across the country. I won't repeat the reasons for that. You will have heard me outline that in some detail to Emily Reader from ITV Border earlier on. But of course, we continue to keep under review whether it is sufficient in terms of the severity and importance of the message we give to the public for those restrictions to be in guidance, or do we think they require to be underlined and given the force of law? Given the force of law, it would of course give police the powers, as they do in other aspects of our pandemic management right now, to, if they find people breaching those restrictions, to apply enforcement measures. Although the police have taken a very proportionate approach to that in other areas, and I would expect them to do that here as well. So that is under active consideration. But of course it will always be, as it is in every aspect of this, it's down to people to do the right thing for the right reasons. If we end up in a situation where, somebody, I live in Glasgow, I'm in a level 3 area, and if I decide I just want to go to the Highlands for the weekend, which, let me just for the avoidance of doubt say I have absolutely no plans to do, then I risk taking the virus from where I live in Glasgow to the Highlands. And the Highlands right now is in level 1, a low level of restrictions relatively. But if I seed the virus into the Highlands and it spreads from there, that is put in jeopardy. So we have to abide by these restrictions. Similarly, travelling elsewhere in the UK or overseas right now, this is a global pandemic, and therefore we all, if we go anywhere right now, we risk taking it or bringing it back, and that's what we've got to mitigate against. As it happens, I think the vast majority of people are abiding by all of the guidance and advice, but there will always be a minority of people who don't. Sometimes that will be inadvertent because perhaps they haven't realised a particular restriction, which is why I repeat them every single day. And others, frankly, we all know the score. There are some who just maybe don't think enough and care enough about what they're doing and the impact on others. I think that is a small minority. But if you know anybody in that category, or if you are perhaps sitting watching right now and think, maybe that's me, we're all just taking risks, not only with our own health if we breach these guidelines, we're taking risks with each other's health. If you're somebody who likes doing extreme sports, then you put yourself no doubt at risk in doing that, and you pose a risk to emergency services if you get into trouble. But if you have an accident and do yourself damage, apart from the burden on our emergency services, you're not harming the rest of the population. This is different. If one of us gets COVID, we have everybody at risk of passing it on. So that's why we all have to be really responsible. It's not just for ourselves right now, it's for each other, which is why I keep talking about those principles of love and solidarity that have to guide our response. Parliament voted for an immediate public inquiry. In statutory public inquiries, I said this in Parliament, it is not the case you can establish a public inquiry overnight. There are important steps that have to be taken. The Scottish Government has started that process. The Health Secretary wrote to her counterparts across the UK to explore whether that could be done or taken forward on a UK basis, and we'll be having discussions with opposition spokespeople in Scotland next week, and we'll keep Parliament updated. But I'll hand over to Fiona, who will want to say more, perhaps about public inquiry, but also care homes more generally.
I think that there will be a time and a place for a public inquiry, but what I think is important now is that we concentrate on doing the very, very best we can for the residents within our care homes, and also the staff who are diligent and do an incredibly important job day in, day out. Since the very start of this outbreak, we've been watching internationally, we've been looking at international research that's been across the UK, research that's happened within Scotland, and as well as more localised, whether it's been root cause analysis or learning that we've taken from how we can support residents in care homes to live the healthiest and best life they can within the quite severe restrictions at times that we have put on them. People who've observed government policy and local policy within the health systems and the care homes themselves will have noticed quite a few changes. So we issued guidance first in March, and that routinely and regularly is reviewed, it's revised, so that we can learn from evidence and research and put that into practice. So I think what's important now is that we continue with that learning, we continue linking. So this week I was talking to colleagues across the UK, and inevitably that talks about the measures we can put in place in care homes to keep our residents safe and support our care home staff to do the great job that they do. And at the moment, we are making sure that lessons are being learned. We've commissioned Directors of Public Health as well as the Executive Board Nurse Directors to have more of an oversight in what's happening with our care homes, working in partnership with the Care Inspectorate, and of course supporting the care home owners and managers who are diligently caring for people and making sure that we put the right measures in place to protect our residents as best we can. So there will always be learning, there will always be improvement, and what's important is that we focus on what we can do to continue with that improvement. And of course, when the public inquiry comes, we will have evidence to submit, and clearly there will be opportunities to look at things, how we could have done better. But I'm confident that there's been a lot of research, a lot of learning, and a lot of changes that we've made to make sure that we're protecting people in our care homes the very best we can.
Thanks very much. Conor Matchett from the Scotsman.
Thank you, First Minister. Two questions, if I may, following on from Tom's, really. I'm wondering what your personal view is at the moment and where you stand, on balance. Are you leaning towards putting travel restrictions into law, or are you leaning towards keeping them as they are as regulation? And secondly, relating to more international news this week, we've seen the so-called leader of the free world peddle conspiracy theories around a COVID-19 affected election. Given we're going to have one of our own in May, can you give us an update on election contingency plans? And are you confident that Scotland's institutions are up for similar attacks from potential conspiracy theorist peddlers?
Thank you, Conor. And on travel restrictions, we haven't reached a decision. It'll be one of the things we're considering over the weekend and into next week. And if we decide not to put them in law just now, and we haven't decided that yet, then it will be something we still keep under ongoing review. I think the most important thing for me, notwithstanding whether travel restrictions are in guidance or in law, is to be very clear with people why we're asking you not to travel outside level 3 areas and not to travel into level 3 areas and not to travel outside Scotland unless it is essential. And I hope I've set out today, again, I think it's self-evident to most people why it's so important that we abide by those. In terms of the question leader of the free world for now, but I won't go any further into the American election. Perhaps we will have an outcome by the time we get out of this briefing, or perhaps not. It is taking a while. Other than to say, I said earlier in the week when I watched the President's speech on election night, I had a sense of foreboding and discomfort at what appeared to be the denial of basic democratic norms. I think it's fair to say that was also my feeling when I watched his speech late last night. In any democracy, it's vital that votes are counted and the outcomes are respected. It doesn't mean that the participants give up their views and that we don't go on and continue to have healthy democratic arguments. But in a democracy, power lies with people, not with politicians. And I think it's important for all of us as politicians to remind ourselves of that. There is contingency planning being done, as you know, and it's been done as far as possible on a cross-party basis. Legislative contingencies being taken forward, just to make sure we are prepared for any eventuality come the time of the Scottish Parliament election in May. I've said repeatedly all along, I think it is vital that election happens. I have no reason to believe that it will not happen. But the way in which it happens, depending on the spread of the virus, may be affected. There may be, of course, a need for greater postal voting. There will no doubt be practical considerations that returning officers have to take into account if physical distancing is still in place, which at the moment I would certainly think we should assume it will be. In terms of the wider issues, I mean, clearly, in modern politics globally, there are concerns about, genuine fake news, not the news that some people would describe as fake news about, social media, presence of bots and the ability to spread misinformation. If you go onto certain Twitter accounts, including, I think, the President's right now and people associated with them, you'll see evidence of the efforts Twitter is now making, perhaps belatedly, to deal with some of that. So this is a big challenge for all of us. I think, and lots of people have to be part of social media companies, law enforcement agencies, political parties. We all have to be part of making sure we have a healthy, vibrant democracy where we have a robust exchange of views, but we all have a general agreement about the basis, the factual basis on which those discussions take place. And I think the onus ultimately on all of us as individual politicians is to respect that ourselves. None of us are perfect, none of us get it right all of the time, but to conduct ourselves in a way that if we all do that, then we all add up to the kind of healthy democracy that we all want to see. And, particularly, because I'll bring this back to COVID, because it is a COVID press briefing, as no doubt many will be reminding me. COVID reminded us of that. Misinformation, when it's about things that don't really matter, might be one thing. But when you've got the ability to spread misinformation on something as important as a global pandemic, you really do see that in some circumstances, lives depend on that. So it really is a sharp reminder for the whole world of the importance of some of these issues we've been talking about. Paul Mallock from the Courier.
Good afternoon, First Minister. I was wondering if you could please clarify if people who have formed extended households in different local authority areas, which might be in differing protection levels, are still able to meet or have their extended household, and would that prevent them from any potential prosecution?
If we go down the road of enforcement, we'll set out all of the limits and sort of restrictions around that so that people, even more important, that people know exactly what they are and are not enabled to do. We try not to affect people's ability to form extended households, and that is true with travel restrictions as well. Extended households are about trying to deal with some of the implications of loneliness and isolation that the pandemic restrictions bring. So we want to protect that as much as possible. But if we move to a more regulated and legal basis for travel restrictions, we'll be very clear about what is allowed and what is not allowed. Mark McLaughlin from The Times.
Good afternoon, First Minister. I hope you haven't been staying up too late watching CNN like the rest of us. A million years ago, when this count started, you said that whoever wins has to act responsibly on vaccines. regardless of who wins, Donald Trump's going to be president until January, and there's talk of a vaccine as early as December. Does Scotland have any skin in the game in the US vaccine? Or are we, all in for the Oxford vaccine? And is there any chance that any US president could take an America first policy on the US vaccine? And even on the Oxford vaccine, do we have a deployment strategy to make sure that it's not an England first strategy or a London first strategy where the biggest part of the UK population is?
I'll maybe Fiona will comment a bit more on the first part of your question, because vaccine all I would say is I'm desperate to see a vaccine developed wherever it comes from. Obviously, any vaccine has to go through appropriate regulatory procedures so that we are all satisfied it is safe for people to have. But obviously, we follow closely the vaccine development in the UK, Oxford, as part of that. But I think the whole world is desperate to see a vaccine as soon as possible, from wherever that comes from. On the second part of your question, yes, I am satisfied on the basis of when there is a vaccine, that in terms of how we procure and secure supplies of that vaccine, and I would imagine wherever it comes from and whatever vaccine gets first out the traps, there will be a limited supply globally for a period while manufacturing of that ramps up. But we procure, just as we do right now for the flu vaccine, we will procure across 4 nations, and there are discussions well developed about that, as there is also a well developed already, but it will continue to develop deployment plan in Scotland for how we will get the vaccine to people as quickly as possible. And that includes issues on which we take advice from the JCVI, the Joint Committee on Vaccination and Immunisation, on the prioritisation of the groups in the population that would be vaccinated, and also plans for the deployment and how we practically deliver that. So plans and discussions in Scotland and between other UK nations are well developed. But Fiona, I don't know whether you can say a bit more about different vaccines and the development process.
And rightly so, this is a global pandemic. The risk of investing in only one area for that vaccine development would have been too great. So there are many researchers, scientists, laboratories and countries developing and growing a vaccine, and some are doing it more rapidly than others. But if you listen to the World Health Organization being very clear, this is a global pandemic. And I think COVID has reminded us of the importance of transcending boundaries when it comes to good public health, because if we didn't do that, then we could be in a very much worse state than we are just now. So the vaccine development, there has been a commitment to look at low and middle income countries as well as more affluent countries like our own, so that it's in everyone's interest to have that good and effective dispersal of the vaccine, so that internationally public health improves. And so yes, there are many other areas where we could be sourcing vaccine, and it's a question of waiting to see how well they are trialled, how safe they are, and of course different vaccines may be more suitable for different age ranges or people with other predisposing conditions. But we're watching it very closely, and as the First Minister says, are making plans to deploy the vaccine as soon as we get it, taking advice across the UK of which people will most benefit from the initial doses that we get.
Thanks. Dan Bevers from The Sun.
Afternoon to you both. First Minister, you raised earlier the latest Modelling the Epidemic report, which shows that the R number could be below 1. It also shows new daily infections per 100,000, the growth rate and the doubling time all seeming to be going in the right direction. So does all that make a lockdown less likely? And just on the issue of mental health, we've seen frequent changes of restrictions and guidance in recent months. And this week you've been saying more restrictions could be necessary, potentially level 4 measures, potentially local travel bans in the coming days. So what impact do you think this sort of constant chopping and changing and keeping people on tenterhooks is having on the nation's mental health?
I'm not trying to keep people on tenterhooks. I'm trying to be straight with people as we go. All leaders face a choice where we can just decide not to speak until we make a decision and then announce it to people. I don't think in a situation like this that would be the right thing, which is why I've done these daily briefings throughout the course of the pandemic, because I think it is better, not perfect, to do what I'm trying to do, which is to take people through the process of decision making and open up and share the factors that guide those decisions. I think I said this quite explicitly earlier in the week. I know that that means as soon as I say, look, we're taking account of X, Y, and Z, and this might lead to this outcome, of course, and this is not a criticism of the media, it's your job, that leads to media speculation. Oh, this might happen or that might happen. Yeah, so yeah, that has its own implications. But I think it's better to try to share with people the processes we're going through and the factors we're taking into account, because I can only tell you what the advice to me leads me to advise all of you, but you're not going to do the right thing just because a politician stands up and tells you to do the right thing. You will do the right thing if you're convinced of the reasons for that and the benefits that we collectively get for that. So I'll continue to do that. It's not about keeping people on tenterhooks. I also want us to have as stable a position as possible, and not always be chopping and changing. We can't rule out having to take decisions relatively quickly. This is a rapidly spreading virus if we allow it to be. But one of the purposes of the level system is to try to get areas of the country onto levels and then give them a bit of time to work to get the infection down so that in time they can come down a level. And that does mean that we will probably not chop and change parts of the country every week. Even if a part of the country thinks, it's time for us to go down a level, you will often possibly hear us say there needs to be a little bit more time just to make sure the improvements are consistent. Beyond that, I'm not going to preempt what the decisions might be on Tuesday for the very simple reason they haven't been taken yet. But just to summarise, everything right now is going in the right direction. And that's good, and that is not down to me or the government. We've taken the decisions, but it's down to all of you abiding by the advice we are given, and it's down to the sacrifices everybody's making. So yes, right now, things are going in the right direction, but this is an infectious virus. So 2 things just to repeat. Firstly, we know how quickly that can turn around. We look internationally right now, and particularly at countries like France, I think Spain, I think Belgium probably would be in this category, where they had a sharp rise of cases of a second wave a bit earlier than we did. And then they had a period where it looked as if, as ours does just now, it's levelling off again. And then suddenly it shot up again. So I worry about that in the next couple of weeks. And that's why we need to be very, very cautious and just guard against complacency. And secondly, as I've been saying ad nauseum this week, our level of infection right now is better than it was 2 or 3 weeks ago. There's no doubt about it. But it's still relatively high, and it's still higher than we are comfortable with. And to illustrate why that is the case, if you think about when we came out of the summer, we drove it down to a very low level, and we've benefited from that, because then when the R number went up, the impact of it was on a very low baseline. And that's one of the reasons why we're probably in a slightly better position than some other parts of the world right now. But if we go into winter with a high level of infection, even if it's a stable high level of infection, any increase in the R number again, which may well happen because people in the winter are more likely to be, indoors, in indoors environments, then that increase in the R number will operate on a higher baseline and more quickly overwhelm us. That's why we have to get the overall level of infection down lower than it is just now, and that will be a factor in the decisions we take over the next few days. That is not me signalling that we're about to put the country into level 4. We will take any decisions around that carefully, but it is probably me signalling that we have to be a bit cautious about too quickly moving too many parts of the country down the level system and opening up too much too quickly, because then we run the risk on that high baseline of things taking off again. So I hope that makes some sense, and we'll try and continue to guide people through the decisions that we reach in the way that we have so far. Do you want to add anything?
I think one of the factors that we do consider when we're developing an advice is the mental health of the people of the country. We've heard some terribly sad and tragic stories of the real negative impact that the lockdown and the restrictions that we put in place have had. And these are quite painful to listen to. But that's why keeping schools opened, it's why in the Central Belt we've kept cafes and now restaurants opened, so that there is an opportunity for people to get out. Gyms, not everyone are members of gyms, but we've made every effort we can to keep them opened, as well as other areas that people enjoy, such as hairdressing. So these are real live decisions that we take, and we absolutely take that into consideration, balancing that with the rate of infection, of course, and the illness and death that might lead to.
Dan Sanderson from the Telegraph.
Thanks very much, First Minister. I just wanted to ask about something you said in your opening remarks. You said there was an issue with the app in that not everyone who tested positive then went on to put the code in. I was just wondering if you had any more information on that. Do you know what proportion of people aren't doing it? And also, just you've spoken a lot or been asked a lot about the travel restrictions that may be tightened. I was just wondering if you'd given any more thought to imposing a legal duty to self-isolate if you're told to by the track and trace teams. Is that something we might see in the next couple of days? And what's your latest thinking on that? Cheers.
We keep all of these things under review, but I wouldn't expect in the next couple of days a shift to a legal duty to self-isolate. We want to encourage and crucially support people to self-isolate, and the payment to people on low incomes is a part of that, but we look continuously at whether there's more to do to support people, and I think you're more likely over the next few weeks to see us focus much more on how we help people self-isolate rather than penalise people when they don't. But of course we don't rule anything out if changes are necessary in the future. On the this is not the first time I've mentioned this issue with the app. So when you have the app, if you test positive, you will be given a code by contact tracers, and it's you putting the code into the app that then triggers the notification to people who've been in contact with you. We know, I don't have data in front of me right now, we may be able to get you some statistics, but we know from the experience of the app so far that not everybody, for whatever reason, is doing that. Most people are, but not everybody is. So I'm just taking the opportunity to remind people that it may be that people don't fully understand they've got to do that. If you get given that code, you must put it into the app. Otherwise, the app will not notify your close contacts. So it's simply about taking the opportunity again today, as I've done before, to remind people of the importance of that. David Ball from the Herald.
Thanks very much, First Minister. Can I ask whether there's been any specific discussions about potentially more measures being needed in Fife, given the increase in hospital admissions and cases in recent days, and whether there's any concern about people travelling into Fife from the Central Belt contributing to this rise in cases? And very quickly on the British and Irish Council, were there any discussions about the frustrations you and other devolved leaders have had about the lack of financial flexibility preventing Scotland to respond to the pandemic? And have you been reassured from the UK government that that won't hamper Scotland's ability to recover the economy as we come out of the crisis?
There were references in the context of the overall discussion about our economic response to COVID to the fiscal constraints that devolved administrations operate under. It wasn't a detailed standalone part of the discussion, but these discussions continue in other Four Nations forums as well. Remember, the British Irish Council has the Republic of Ireland government and the Crown dependencies, so some of these Four Nations discussions are certainly relevant and get mentioned, but it's not the forum for in-depth discussion about fiscal arrangements. But I think that these are issues that we are keen to progress, and I think the same is true, although they can speak for themselves on the part of Wales and Northern Ireland. In relation to Fife, so we will be looking over the weekend and in advance of Tuesday at all local authorities at their case numbers per 100,000, the direction of travel with infection, is it rising or falling, what the projections are, hospital capacity, and then we'll be applying judgment to that and coming to decisions about whether each local authority is in the right level now, or whether they need to go up a level, or whether in some, and I expect a limited number of cases, if at all, come down a level at this stage. Fife, and I don't want to preempt those decisions before they are taken, suffice to say Fife is one of the local authorities that, because of the things that you have spoken about, we will be looking at very closely, and I certainly wouldn't rule out the application of a higher level to Fife at this stage, but nor am I indicating that that is a decision that is taken. But we do see some indicators in Fife that give us pause for thought and a bit of concern. But I don't know, and I cannot stand here and say that that is because of people travelling from the Central Belt into Fife. But unless you have an essential reason to do that, for the reasons I've spoken about, work you can't do from home or caring for a vulnerable person, then please don't do that. If you live in a level 3 area, you should not be travelling to other parts of Scotland because you risk taking the virus with you. I can't say that that has happened in any particular context, but that is a very real risk, which is why we advise so strongly against it. Libby Brooks from The Guardian.
Thanks, First Minister. I just wanted to follow up on the British Irish Council discussions too. You'd said that one of the key strands was future travel restrictions, I assume sort of potentially between the 4 nations and other areas. Can you say anything at the moment about what that might look like? And I did also want to ask, just after the meeting, if you feel reassured following the concerns that both the Scottish Government and Welsh Government have raised in the past few months about poor communication from Westminster. Thank you.
On the latter part of the question, I'm not sure. We had a good discussion at the British Irish Council. They are always constructive opportunities, and that very much includes the UK government. I'm not sure the summit this morning was ever going to, satisfy or reassure substantially the Scottish or Welsh government about some of these long-standing issues around communication. We are all working on those, and again, that includes the UK government trying to get that on a better footing. But I think there is still work to be done there. On travel, I can't say more than I have said. It was raised, so we didn't come to any decisions today or didn't go into the detail of exactly what that might look like. But there's a recognition, I think, across the common travel area, as there is across Europe and the world, that a key part of what all countries have to do to stop this virus spreading is to limit travel and to mitigate, when there is travel, against the opportunities for the virus to spread. And clearly those discussions will always be both particularly important but also particularly difficult and sensitive when it's your closest neighbours that you're talking about. But there's a real spirit within the British Irish Council to approach these discussions very constructively, and I'm sure we will have further interactions and engagement over the weeks to come. And that is, Libby, thank you, Libby, was our last question today. I don't know, Fiona, whether you had any final point you wanted to make, or...
Just one final point, if I may, First Minister. When I was talking about care homes, one of the lessons that we have learned is how important that relative access and relative visiting is for people in care homes, and to give our commitment that we are continuing to navigate our way through how we keep our older people safe, but also have access to their loved ones, because we just know how important that is to people. And of course, encourage everyone to keep following the rules that are so important for us.
Thanks very much. Thanks to all the journalists for joining us today. My thanks to Rachel for the BSL interpretation, and thanks to Fiona for helping me answer the questions. And thanks to all of you for joining us. Let me just end really on a theme that has been very to the fore throughout the question and answer session today. And that is, we are seeing positive signs right now in Scotland, and that is down to all of the sacrifices everybody's been making. So I really can't thank people enough for that. But we know we're in this. This is a long haul. It's an ongoing challenge. And I think, as we know from experience of having driven it down over the summer to then be faced with a second wave, as many countries are right now, I think we know from that experience now that we can't afford to drop our guard. We have to stay on top of this, and that is even more important as we go into the winter months, when that need to protect our National Health Service so that it's not overwhelmed by COVID, but also so that it can continue to treat COVID patients and non-COVID patients is so important, and the need to continue to restrict transmission as much as possible to protect health and to save lives. These things all remain so crucial if we are to see this progress continue, and to see it continue sufficiently to allow, hopefully, over the latter part of this year, and particularly over the Christmas period, some sensible and safe normality return for that period, so that we can enjoy a bit more some interaction with our loved ones. So all of that means that we cannot take our foot off the brake on this right now. We have to continue with these sacrifices. So please do that over the weekend and into next week. That is about not travelling into higher prevalence areas, level 3 areas, not travelling from those areas to lower prevalence areas, staying out of other people's houses, and making sure that you're working from home as far as you can, and remembering facts. Wear your face coverings, avoid crowded places, as we've been stressing today, clean your hands, clean the surfaces you're touching, keep a 2 metre distance from people you're coming into contact with, and self-isolate immediately and book a test if you have any of the symptoms of COVID. If you've got a new cough, if you have a fever, or if you experience a loss of or change in your sense of taste or smell, don't hang around, don't wait to see if you feel better, book a test straight away and self-isolate straight away. These things are all tough, but they are making a difference, so let's stick with it and keep seeing that progress. Thank you all very much. I'll be back here at 12:15 on Monday. And on Tuesday, as you've been hearing throughout the week, I will set out to the Scottish Parliament the first weekly review, the outcome of the first weekly review of the allocation of levels to different parts of the country. But before that, I will see you back here on Monday. In the meantime, have as good a weekend as it is possible to have in these really difficult times. Thank you.